Just be recording so everybody knows. Welcome everybody. Thank you so much for joining us on this Friday morning. We'll be talking about a case study using Theory U to address food insecurity. And also we invite you to think about the other inequities that are affecting health and well-being in your communities and how this could also be applied. So as we're sharing this case study, think about where might something like this be useful for you. And Theory U is really a scaffolding for leading change initiatives. So there's many different ways to lead change, and this is one of many different theories of theory of change that we think is useful. So this is the arc of Theory U. So you can see here it starts with shared intent. So we gather together and figure out what is the shared intent of our change initiative? What is it that we're trying to accomplish? And then together coming up with different elements that help people articulate and see the need that they're working to address. And then also maybe perhaps either a vision or a purpose statement about where it is you're trying to go. Knowing that that might be iterative, that might change along the way, but starting off with some foundational pieces to help you think through where it is you're trying to go. So we start off with shared intent. And then from shared intent, we sort of dive in. You can see there's a loop down towards diving in and a deep immersion into gaining a systems perspective. This is a key element to leading change because oftentimes we go into change initiatives thinking that we know the answer or we know the landscape. But what this piece invites you to do is to actually widen your lens and your perspective of the greater system with which you're operating in. So it takes a lot of conversations with people directly affected by the issues at hand. It takes working with different partners that are working to address those same inequities within your community and really going out and figuring out what are the big issues, what are the big challenges that are occurring, and really opening up your own perspective in massive ways compared to when you start the process. And then once you go out into the system and start to see this bigger perspective, the next sort of part of the arc is called meaning making. So you start sharing with others that are also doing this wider systems perspective. You come together to both reflect and to make meaning of what it is that you're learning from this bigger system. And then together, that's even more amount of information that you're learning across the system by hearing from each other about what you're learning in this piece. And then from there, in Theory U, they say act in an instant. There's so much wisdom that's been gathered within the system that now you're able to start to think about what are potential prototypes or initiatives or solutions that are needed. What is the big problem? And so then you're able to, because of that bigger understanding of the system, begin to start to prototype solutions. And we call it co-creating the future. And in Theory U, there's a lot of talking about, there's a future that wants to happen. How do we meet that future? And then from there, we go into co-evolving and planning the next steps. You take initiatives that you prototyped and hopefully piloted, and you get a sense of what's actually really working. Right? Which of these prototypes is going to actually create the greatest level of impact, and how do we scale that? Some of the prototypes get thrown out because we learn that they're actually not working if we do our due diligence. So that's it. Oh, somebody just joined. If you don't mind just muting your computers if you're not speaking, that would be great. Thank you. So we go into scaling once we find proper prototypes. And this speaks to these same phases again. And these are sort of key inquiries and questions throughout those 5 phases. So with shared intent in the beginning, what's the shared intent of our work? What is our purpose and what need are we addressing? For phase 2, the systems perspective. And all of these elements you should know are linked to each other. So one precedes the other. And they can also be iterative. So sometimes you have to go back to the drawing board. So it's not necessarily a linear process. So systems perspective, what does the greater system reveal to us when we listen and seek out diverse perspectives? Meaning making, what meaning do we make from this greater level of systems perspective? Who am I within this greater system and what is mine to do, right? So there's some leadership reflection that takes place in the meaning making. Where is my sphere of influence and what kind of impact can I have based upon what we're learning? Where can I create the most amount of change? And then where can we collectively, as a system, create the greatest level of change? and then start prototyping and acting in an instant. What's the future that wants to emerge? What potential ideas might be solutions addressing upstream issues? And you can come up with many different ideas in this phase to figure out and weave through and determine what is the greatest impact. What is the thing we can do together that will create solutions for our challenge? And then from there, scaling the prototypes that are feasible and impactful and that we can scale. And then there's this question, I think, around Theory U. Why use Theory U? Well, what if you have no framework? If you're trying to do a change initiative and you just step in to do change, oftentimes we just repeat what's already not working. And you can see in many of our failing systems that keeps happening, and we keep getting the same results that nobody wants. And so using a framework like this can help you actually gain that system's perspective and have conversations and include the voices of those directly impacted. It's scaffolding. It's an outline to help you have the clarity about what to do in different phases as you move through the process, and helps you know, this is where I need to focus my attention. I'm in this phase, so this is where I focus my attention. And they feed off of each other and is iterative. So sometimes you go back to the drawing board. We focus directly on those impacted. So through the systems perspective, this is a great way to do proper community engagement where you're actually including those voices and making sure that that is relevant to the solution. Napa County engaged 33 partner organizations, each by coming together in convenings, which Jennifer Henn and Jennifer Palmer will share with us. You know, they also increased their own understanding of the system just by coming together as partners to see what it is that's happening and be in conversation to each other and to amplify the wisdom of the county around food insecurity issues. And it's like Theory U is a guide and a process that leads towards action, right? Oftentimes people complain about using too much process, but really you're using the process for the end of getting to action. And ultimately it's a theory of change, right? We believe that if you do this, if you use this movement, that transformation will take place in meaningful ways. So that is just an intro frame around Theory U, and I'm going to stop my screen share and turn it over to Jennifer Henn and Jennifer Palmer in Napa County to share the case study.
Okay, great. So let's just get this set up. Okay. So can you see that now, Dana? Can you see
Yes.
our PowerPoint? Yeah. Okay.
Yeah, and if you just press play, then it'll get bigger.
Okay, we're going to stop our video sharing for right now. I find it a little bit distracting. Let's see. Okay, and you can see it in full screen now, Dana?
Yes.
Thank you. Okay, so I'm Jennifer Henn. I'm a public health manager and epidemiologist with our Health and Human Services Agency here in Napa County. And my team helps support our Live Healthy Napa County Community Collaborative.
And I'm Jennifer Palmer. I'm a project manager with our Health and Human Services Agency, and I work primarily in our homeless programs and emergency food solutions.
So we're going to be talking today about our emergency food systems study, which was designed to take a deeper dive into barriers to accessing the emergency food system from a user-centered perspective, so from the center of the people actually using the system. And so as Dana just described, Theory U is a model that can be utilized to guide you through a change process. And today we want to discuss how we've used Theory U in Napa County to address the central issue of our ACH work, which is food insecurity. This work has taken place over the past 6 months, and so we're going to walk through what each of the steps in Theory U looked like for us, really with the exception of scale, because we're just not there yet. But before we launch into the case example, we wanted to provide a little background on our ACH to set the context for this work. So Our Live Healthy Napa County, or LINC as we call it, collaborative, has served as the convener for all of our meetings with community partners where we've utilized Theory U in the study of the emergency food system. LINC is also our accountable community health model for Napa County. And this collaborative has been in existence since 2012. It's a group that came together with a vision for improving the health and well-being of everyone in Napa County. And since we're talking to a group of accelerator sites here, I thought I'd throw in our design challenge question, which is how might the Live Healthy Napa County ACH focus on upstream issues and leverage the work of various stakeholder groups in Napa County to increase their impact on the health and well-being of our residents. So you can see that this is really a group that has a strong focus on addressing the social determinants of health inequities. And when the California Accountable Communities for Health grant first came out in 2016, we saw LINC as having at least started on many of the definitional elements of an ACH. So I put 4 of the definitional elements on the right-hand side of the slide. And so we have active participation from a number of different sectors in our community, including healthcare, local government, nonprofits, education, and others. Although we don't have a formal governance structure, we do have a small leadership team. Community engagement, I know, has only recently been added as a definitional element in the ACH model, but it's something that's been incorporated into our LINC work from the start. We actually started out by conducting a community health assessment and improvement plan that involved extensive community engagement. And then finally, as I mentioned, the Health and Human Services Agency Public Health Division has provided the backbone support for the work of this collaborative since it started. And so back in 2016, when the CACHI grant first came out for the Catalyst site, Live Healthy Napa County thought that our area of focus should be on obesity. I'm not going to go through the details in the boxes on this slide. I'm just including it to show our thinking at the time around having a portfolio of interventions, figuring out which health condition to focus on. I think it was recommended that it was one or a set of related chronic disease conditions was a bit of a challenge for us at the time because our group had been more focused on upstream factors that lead to health inequities and hadn't really come together around one central issue. And so in the end, though, we weren't funded as a Catalyst site, and our work continued with an upstream focus. And then in early 2017, I think before the Accelerator site grant for CACHI started, we had a strategic planning session with our LINC partners in preparation for our next health assessment. And during that meeting, our partners selected food insecurity as a priority area for focus. And I just want to say a word about why a group focused on health would be wanting to focus on food insecurity. What we know is that food insecurity is a risk factor for adverse health outcomes. It's associated with conditions like type 2 diabetes and cardiovascular disease, and also makes those conditions very difficult to manage. And we also know that it's a risk factor for obesity, which had been the initial focus for our ACH work. And so the selection of food insecurity as a priority area for LINC happened to dovetail with work starting to emerge from a smaller grant received by the Robert Wood Johnson Foundation. And I'm going to turn it over to Jennifer Palmer to describe that work.
So concurrent with our application to the CACHI grant, we had also submitted an application to the Invest Health grant and were awarded that grant in partnership with our local hospital and some housing providers with a focus on solutions that would benefit our precariously housed population. So our grant, the Invest Health grant, is designed to incentivize work at the intersection of health, social justice, and economic development. So its goal was to bring diverse sectors within small and mid-sized cities together to focus on an issue of both health and economic investment. And we proposed solutions around our housing problem in the community. And an early work to try and quantify a precariously housed population in the community. So one step away from homelessness, we chose to focus on data measures showing who was accessing low and no cost food, to essentially use that as a proxy measure for how many folks in the community were in need of or were at risk of becoming homeless. What we found as we began to compile that data was that there is this huge number of people who are accessing emergency food in the community, but that, as this slide shows, the numbers don't align in a very logical way. So we have 36,000 residents living below the poverty line, so below 185% of the federal poverty level, which would qualify every one of them for participation in CalFresh, eligible for the food bank, and their children for a free and reduced meal at the schools. And yet, as the slide indicates, only about 25% are accessing any one of those programs. And across the programs, there's very little consistency to how many people are accessing. So 1,200 children are represented in the 5,500 individuals accessing the food bank, and yet 8,400 students qualify for a free and reduced meal at the school. So what the data ultimately told us was there are barriers that exist for users and eligible non-users of the emergency food system that were not obvious to us and not obvious to our service providers. And we began to talk to the service providers and the resource centers in the community about that issue and started to talk about what we needed to learn in order to begin to develop solutions for that. And what emerged from that was we needed a study of the emergency food system from the standpoint of the users as opposed to the service providers, to better understand what are their issues in order to bring the community together around solutions. And so from the earliest part of what we were doing, when Dana described one of the phases as developing shared intent, I think even from the time at which we began to conceive of a study, we were developing shared intent among the folks who wanted the information, as well as later then developing shared intent with the actual users and non-users of the system. So we had about 20 partners come together and work on the overall scope of what did we want to do for the study. And then those same partners were involved in the selection of the contractor, Public Health Institute, that actually worked with us on the study itself. So that shared intent really was from the very beginning of the study. And then once we had this partnership of folks who all agreed that this was a really essential study, we then applied for funding from Kaiser Community Benefits, a local foundation in Napa, the Gasser Foundation, our local hospital, Queen of the Valley Community Benefits, and leveraged some existing funding within our County Health and Human Services agency on a whole person care grant. And a big part of our ability to attract that funding was the fact that we could point to a process by which 20 partners were all agreeing that this was a really essential piece of data to collect.
Okay, so, and then as we move into phase 2, which is systems perspective, this really started taking shape as part of our first Live Healthy Napa County convening for the emergency food system study. So that convening, just to give time context, was last January. And a primary objective was to develop the systems perspective. So in this phase, we are deepening our understanding of the emergency food system and the users of the system. And what this looked like in terms of the design of our meeting was that we asked our partners to help us create the strategy for surveying users and non-users of the system. We had our participants break out into groups and answer a series of questions on a template. And we asked them, who is experiencing food insecurity in Napa County? Where are they? How do we successfully outreach to them? And who are the liaisons that can help us reach them? And so what you're seeing here on the slide is that the information that the groups gathered was then harvested as a group process, and that everybody in the room was given sticky dots to vote for the priority populations that they wanted to reach with the study and the key liaisons or conveners that could help us reach these priority populations. And so what we ended up with through this process was 5 priority populations: older adults, families with youth, low income, monolingual Spanish speakers, low income neighborhoods, and people experiencing homelessness. And obviously there's overlap between those groups that were selected. Also, through this, 26 partner agencies were identified that could help us to administer the surveys, so that each partner would be assigned to conduct a very small number of surveys, usually in the range of 10 to 20, so that it made it reasonable to accomplish in the limited time frame we had to do this study. I don't think we mentioned yet that this study was actually set to kick off on October 9th of 2017, which was the day that our wildfire started in Napa County. So we had quite a significant delay in starting, and so when it actually came to this phase of doing surveys, we had about 2 weeks to conduct 350 surveys. And I think the other thing that it's important to note at this point about this process is we really didn't have a plan set in stone for how these surveys were going to be conducted, and that was a really positive thing for this process. The contract we had with PHI had flexibility in it, and so that when we saw kind of the volume of information and the richness of information that came out of this first convening, we were able to kind of change our thinking about the best way to proceed with the study. The original study had proposed that our consultants would conduct intercept interviews in person in the community. But in light of what we saw from this meeting and the fact that we were having ICE raids in our community at the time that we wanted to conduct this study, and there was a lot of fear, we realized that we would be better off to have our community partners participate more directly in the study. And that decision was made based on knowledge of the trusted relationships our partners have established with our residents. And then also, I think the other thing is that having our partners do the direct outreach for the survey benefited the study in that we were able to maximize participation from our harder to reach populations. And it also helped to foster a sense of shared commitment to the findings and recommendations that are going to come out of this study.
And just one last note on that, from a administrative side, I think from Jennifer and my perspective, when she's discussing the iterative process that we went through, even with managing the contract, the color commentary I would add there is this has been both one of the most challenging and invigorating projects we've worked on. So the iterative process has been wonderful and in the end deeply satisfying. It is also a challenging thing to do when you're in the midst of the work. So we've loved it, but it has it's challenged us quite a bit as we've gone through it. So the third phase of our study involved collecting all of the information from the surveys, doing analysis on what that data meant, and then bringing our community partners back together to share that data and collectively make meaning. And what I want to talk about here is just the structure of that second community meeting and the way in which we moved folks through the data. What we have done at the start of every one of our community meetings, we always reground everyone in why are we here and the work that led to getting there. Most of the folks that participated in the first meeting also participated in the second and the third, but we did have the population change. Different stakeholders came and went. And so it was important to reorient everyone, to sort of ground us all in that same story of how is Link the convener, what work happened to get this study underway and bring us to where we are. In this case, then, we had a lot of data, a lot of quantitative and qualitative data to share, and we were very excited to present it. And we had a process by which, again, participants were given a template to look at the data and answer questions that helped them, that helped frame What are they looking at? How do they feel about it? What are they learning? What else would they like to learn? But one of the most powerful parts of this meeting, which we have ended up using as a part of every presentation we've done on the study since this meeting, was a reading of direct quotes from the users themselves. So after grounding everyone in the initial purpose of the meeting, we asked them to step over into a more open part of the room and form a large circle. And when they had entered the meeting, everyone had been given a card that had a quote on one side and some basic demographic information on the other, and they were all direct excerpts from the studies. And we asked participants at the meeting to simply step forward one at a time into the circle and read the quotes that they were holding. And it was an extraordinarily powerful way to start the meeting, and an intentional way of bringing both the head and the heart together into what we were going to do that day. And so just to share the context of the kinds of quotes that we received from the survey, and so what happened in that circle, one of the quotes was, "I get a meal one time a day for sure. Sometimes it's the only thing I eat." And that came from an older adult between the ages of 80 and 90 years old who is at risk for food insecurity.
So the second part of this convening, in which we were in the phase of making meaning, was to use one of the tools that's been highlighted, again, as part of the CASHI work, which is the what, so what, now what line of questioning. And what we needed from our participants in this phase, after they've reviewed the data in our gallery walk and through the quotes, was to help us determine the areas of inquiry for 3 focus groups that were to be conducted in the month of May. The purpose of conducting the focus groups was to take a deeper dive into some of the barriers identified in the survey. So we needed our community partners to help us identify what else they wanted to know from the users of the food system to make the study findings truly informative to our work. And so what this looked like in terms of the process was we had participants in small groups at tables, and we asked them, based on what they had noted down during the gallery walk, what factual information they had observed, so that's the what it might mean, that's the so what, and then finally the now what piece was where we asked about our inquiry for our upcoming focus groups, specifically for them to help guide us in what else we needed to know. And then I'll just briefly touch on some of the key findings around barriers in this survey, in case that's of interest too. What our survey revealed was that the most frequently stated reason for our respondents not participating in the food system was that they were simply not aware of the programs. Another common barrier was that they didn't know about or weren't sure that they met the eligibility or qualification requirements. So we didn't ask about income, so we weren't certain that people did or did not meet qualification requirements, but many of the statements from the survey were, "I don't think I would qualify," or "I don't want to share my information." And so there was a lot of perception around potentially not qualifying for the programs. And then finally, the third big category of barrier that our survey identified was a variety of reasons for physically not being able to attend programs. And these range from, the program being at an inconvenient time or location, that they had a lack of transportation to be able to get to the programs, or a lack of time in their schedule to be able to wait. Some of these programs have fairly long wait times to access the food, so they didn't have time in their work schedule to be able to do that.
And the way that we then, as a group, determined what would be the areas of inquiry for the focus group was to take each of those issues and try to formulate what is it that we want to know, what more do we want to know from focus group participants in order to really have enough data to move into a prototyping phase. So with regard to lack of communication, the question then was, how do you like to get information? With regard to questions or perceptions about eligibility, we looked at what would you change about the services that you receive. For not able to attend, the question was, what would make accessing easier? There was an understanding from the group that there was perhaps stigma involved in simply accessing the food and not understanding whether that was across all groups or just with certain respondents. We then wanted to ask in the focus groups, how does the process of accessing information or food make you feel? And why don't you think the food is for you? Was really that there were several answers in the survey. There were not even several, there were a lot of answers in the survey that said, other people need it more than I do, despite the fact that those folks had also answered questions that showed that they were at risk for food insecurity. So trying to dive a little deeper to why is it that when you are at risk for food insecurity, you still don't think the emergency food system is available for you to access. And we designed the focus groups, just to say a quick word about the actual format of the focus groups. We had 3. We used partner organizations in the community to recruit for those focus groups. So the same community partners who participated in our community meetings were actively involved in the recruitment for participants. We held them at the places where those participants would regularly engage already. So the older adult focus group was held at the senior center. The adults experiencing homelessness focus group was held at the South Napa shelter. And the low-income Spanish-speaking families was held at one of the schools. They were each 90 minutes with about 60 minutes of diving into these questions, a 10-minute break, and then the last 20 minutes spent on soliciting solutions from those folks. So first really exploring the barriers and then asking them if they could essentially wave their magic wand and make something different occur in the community. What would it be that would eliminate the barriers they had just discussed? And finally, we provided all participants with a $25 gift card for participation.
Okay, so we consider the focus groups to kind of be between phases 3 and 4, maybe like a phase 3.5 in terms of the theory U, because in the focus groups, as Jennifer just mentioned, they were identifying and digging deeper into the barriers. So that's the making meaning part. And they were starting to talk about solutions for the barriers that they had chosen to discuss, but they weren't quite at the point of what we would consider traditional prototyping. So as she said, we had 3 focus groups with individuals experiencing homelessness, older adults, and then Spanish-speaking low-income families. So one focus group for each of those population groups. And initially, we had discussed whether it would make sense to incorporate a traditional prototyping exercise into the focus groups, like having participants build with modeling materials or help diagram out what the solution to the barrier would look like. But ultimately, we decided that this might not be well received by our participants and could even be perceived as being insulting, given that being food insecure, or given that being food insecure and homeless puts you in a very vulnerable place, and in a place where you really might not be in the space to undertake a more creative process that's often involved in prototyping. So initially, we did think that we would be doing more prototyping at this point in the study, and we ultimately backed off on that in order to be sensitive to the people participating in our focus groups.
So we held 3 focus groups, and as a way to help share the information that we received from the focus groups, we contracted with a graphic recorder she was not in the room during the focus groups. We actually recorded all of the focus groups and sent her the recording. And so she did these offsite, but this was a way to visualize the framework of each focus group and the feedback that we received. So what we want to both show that we used graphic recordings as a part of this study and also highlight some of the kinds of things that came out of each of the focus groups. So in this case, this is the graphic recording for adults experiencing homelessness. We asked them, we listed the top 6 barriers from the survey results and asked the participants to identify the top 3 barriers that they would like to discuss in the focus group. Adults experiencing homelessness identified stigma, using the food, and transportation. And I will, for this, just highlight some of what we received back in terms of feedback for using the food. Our adults experiencing homelessness are some of the best utilizers of the emergency food based on their emergency food system. Based on their survey results, they're often accessing 3 or more of the emergency food programs in the county. However, they're still disproportionately experiencing food insecurity. And some of the reasons that we heard for that are the challenges that they face in storing food and cooking food. So our shelter does not allow overnight storage of food. They can't bring it in the evening. So no amount of distribution from our food bank in one day will provide any sense of food security for the second day. Concurrent with that is our food bank allows access to the pantries 1 time per month. So you can get a really big distribution, almost 12 bags of food, but if you're homeless, you can't really do a lot with that. In addition, they don't have any ability to refrigerate anything. So things like dairy, meat, that sort of thing spoil quickly. And lastly, what they identified is without the means to use any sort of kitchen preparation, their ability to actually utilize a lot of the food to prepare it in any way is greatly limited. So when we move to the solution phase, soliciting solutions, some of what they asked, some are just so simple. I mean, they just simply asked for, could they have some sort of food storage, like a refrigerated locker at the shelter? Could there be something along those lines? But one of the solutions that we particularly loved was most of our parks in Napa County have grills for public use, but they are charcoal grills. And so the residents experiencing homelessness asked, could we simply convert those to be solar powered so that they would have ready access to using them? And that's such a simple, low cost solution that would not have occurred to any of us in the same way that it was apparently a very obvious solution to them. So it was a great illustration of when you actually ask the user, you get very different perspectives than when you're asking the provider.
This next graphic recording is from our focus group with older adults experiencing food insecurity. And so our older adult focus group identified transportation, using the food, again, and awareness as the barriers, the top barriers that they wanted to discuss. So I'll just mention quickly that being able to utilize the food they received, as with the homeless, was a barrier for older adults. But that here we heard a little bit greater emphasis on dietary restrictions due to chronic conditions, such as, the food has too much sodium, or, I can't remember one. They wanted a vegetarian diet. So the more emphasis.
Teeth.
Oh, right, and not able to eat the food because of problems with their teeth. So it was a little bit in contrast to utilizing the food with our homeless group, as there was greater emphasis on being able to use food to manage a chronic condition. But what I want to highlight here is around the transportation barrier, which came up for both our individuals experiencing homelessness and older adults. So both groups discussed lack of personal transportation as a barrier to accessing food programs. Older adults talked about the difficulty using public transportation to get to food programs, with comments touching on things like wait time, reduced bus service on Sundays, and the difficulty of having to make bus transfers to get to food programs when you have mobility issues. The other issue that came up was some of our food programs distribute a tremendous amount of food at any one time. And so for older adults taking public transportation, it becomes very difficult to be able to carry that food back to their home. And then some older adults in the focus group could no longer drive, but others said that they would be happy to take others to pick up food, and they mentioned coordinating a carpool type system, but their barrier there was really being able to afford the gas. And so suggested solutions in this area, primarily included things like having more distribution sites or bringing food to places closer to where low-income seniors are living. And this had a lot of similarities with our homeless population as well. They thought they suggested some other solutions for transportation. They ultimately were hoping for a solution that would bring the food closer to where they were to make it difficult, to make it easier to access. I think that's all I want to highlight on this one.
Our last group was Spanish-speaking low-income families. This group was conducted in Spanish, and so we had the graphic recording also done in Spanish. When we've held our community meeting, we did provide translations for monolingual English speakers to understand the data, but we felt it was really important to represent it in Spanish as a part of the study. The area I want to focus on here was a key barrier identified by these folks was date and time for access. Most of the participants in this group are working parents, and they identified that the times of day that most programs, whether it is distribution of food or application for cash aid assistance, take place during the workday, and were in and of themselves a significant barrier to their ability to access those programs. They also, it is represented on this graphic recording as immigration status, but communication was across all of these groups a really key barrier identified. And the way that it came out in this focus group, while it's represented as immigration status, was that the families wanted clear understanding of which programs required immigration status as a condition of eligibility and which ones that was not going to be asked about. There was a perception that most of the programs required some sort of immigration status confirmation, where really that is only true for the cash aid programs. And all they were asking for was really clear communication about who's going to ask me what when I go. And we feel like that communication alone would significantly impact their willingness to access programs that they're eligible for. The solutions were, again, extremely simple, like the communication, a chart that simply said, what do I need to have to apply for the various programs, but also alternative hours, asking for evening services and weekend services for both food distribution and applications for cash aid programs, as well as the exploration of what would be place-based services. So could food pantries have distribution points at the schools prior to or just after drop-off or pickup for the students? So bringing it to a place they were already going so that there wasn't an additional time constraint or transportation constraint. What we did then was take these graphic recordings and, again, bring the community together for a community meeting just on Monday. That feels further away at this point. And what we did in this meeting was share the outcomes from the focus groups in a similar fashion to what we did with the survey results. So there was a chance to have a gallery walk. People walked silently through the room, evaluating what they were seeing, and had a template in front of them to make notes, guiding them through a series of questions and reflections on, in this case, we used an empathy map. So charting what were they seeing, how did they believe the user was feeling when they gave this feedback, what did it bring up for them as they were evaluating it themselves, and what kinds of solutions might help overcome the barriers that were identified. we then brought everybody together and asked them to brainstorm solutions for a few minutes on their own, and then working in tables of 5, talk to each other about the solutions that they had come up with and work together to physically map them on an impact and feasibility matrix. So the impact and feasibility matrix is a way of helping everyone understand what are the solutions that are perhaps lower impact but highly feasible. And so that would be the low-hanging fruit solutions, the things that you could do quickly to sort of gather some steam. What would be the high impact, high feasibility things that you could really bring a lot of community members around because it's likely to move the needle and it is very achievable. And then some others that maybe are less feasible but will also have high impact, being stretch goals or large, long-term community undertakings. And it was a valuable framework for the discussion of ideas in that sense that there is no bad idea, but helping everyone understand that not all ideas are as immediately implementable, and beginning to think through what kinds of partners would you need to bring in to achieve the various ideas. So some of what came out from those meetings were the idea of an overarching communication center, sort of like a coordinated entry system that the homeless service system has, but for emergency food assistance, an app-based network to connect donors, volunteers, and users so that there was a central place where someone with excess food could note that they had it, someone else who needed the food could identify where it needed to go, and a volunteer could sign up to take it from point A to point B. Also community kitchens for shared cooking and shared meals. One of the ones that we thought was really interesting was mandating that a certain percentage of all public landscaping money be geared towards food-bearing landscaping in the community. And finally, community-supported agriculture supported by anchor institutions in the community so that the food itself could be made available in a tiered system, essentially that the anchor institutions would act as the underwriter of the community-supported agriculture, so using their procurement policies to purchase enough food from the CSAs to make them sustainable, and using some of the profit from that to offset the cost for folks with lower incomes to be able to access the food, but at a lower cost than maybe folks at a higher income.
Okay, and so this is our last slide. Currently, we're working with our wonderful consultants at PHI to finalize the study report, which includes an interactive Live Stories webpage that will help us tell the story of food insecurity from the perspective of the users of the emergency food system. And our next steps will include presenting results to additional community groups and potentially also helping to facilitate prototyping sessions involving both community partners and some users of the emergency food system. We hope that at least a handful of solutions that come out of this study will be brought to scale. We would envision this being done by different community groups as part of a collective impact effort rather than solely being driven by the ACH. And we are also looking at how the solutions identified and tested as part of this Theory U framework can help inform the portfolio of interventions for our ACH work. This trajectory is somewhat in contrast to where we were in 2016 when we first applied for the ACH grant. And I think as Jennifer has mentioned previously, it certainly wasn't a straight line to get to where we were today. In 2016, we thought obesity was the issue our ACH should be focusing on, and our portfolio of interventions developed for the grant application was primarily made up of activities already underway, which is to say that they weren't selected as part of a coordinated process to identify the root causes and solutions to the issue. So using Theory U in this way and really involving partners in our ACH from the beginning has felt like a more organic and inclusive process that we hope will lead us to a stronger portfolio of interventions for this work. In terms of takeaways for us, we definitely had to develop a level of comfort with the work that has felt very messy at times. we haven't always known exactly where we were going with this or whether things would work out. But I think that this is a big part of being authentically engaged with the community and our community partners in the process of joint design. So in closing, I would just say that we're excited for the next steps in this study, and we're happy to take any questions that people might have.
Great. Thank you so much, Jennifer Palmer and Jennifer Henn. Let's open it up for questions. You can put them either on the chat box, or if you want to unmute yourself. Most of you are muted, so if you are speaking, we can't hear you. I can ask a question. I mean, one thing I'm noticing going through this with you here is just, you know, there is an ample amount of food in the county that people could have access to, but a lot of it is really just how the bigger community is coordinating the responses and making sure that they're all communicating with each other to increase access. That's just one noticing and reflection that I'm seeing from your presentation. Does that seem accurate?
Absolutely. It does. That again was one of those initial background conditions that was really fascinating as we looked at the data and we're talking to service providers prior to really even beginning to craft the study, that there was this fascinating dynamic between the growing number of residents who are experiencing food insecurity, the lack of access in the community, and an excess of food. That the food bank has come up with really creative distribution methods around what they're calling Friday free markets, which are produce and fresh fruit giveaways at 5 different locations throughout the community on every Friday, in an effort to get food into the community before it was spoiling at the food bank. Mm-hmm. And we saw, again, there was this little tiny addendum to this study. Our kickoff date was postponed by the fires, which then led to this study not kicking off until January, but it also gave us a chance to reflect on, during the disaster, food came out of the woodwork in this community, from donors to get to evacuees, to get to the first responders. It was as if the entire community wanted to sit down and break bread together. And we were fascinated by the notion that a time-sensitive disaster inspired that kind of response, but the non-time sensitive disaster that our study was taking a look at did not have that level of engagement across the board. And that little bit of look from the donor standpoint with our study addendum essentially showed the same thing that the user-centered study did, which is the issue is not talked about. There's not enough of broad-scale understanding in the community. And so communication really becomes the low-hanging fruit on the solution of food insecurity, that donors need to know who needs help. They need to know the scale of the problem in the community and need to have more facilitators to make those donations land where they need to go. And users need the same help. They need to know where to go, and they need some facilitators to get to where the food is. But it was fascinating to see that essentially, if we just simply got better about talking about the issue and made really clear where access points are and shared this information with the community that we do now at the other end of the study, we're very excited to put this information at work in the community, because it feels like such an infinitely solvable problem based on what we learned on both the user and the donor side.
Mm-hmm. Wonderful, thank you. Other questions? We have time for another question.
Or just reflections. I think, you know what, just having gone through this, what really struck me was how powerful, I think Jennifer, you know, Henn, Palmer, excuse me, you just talked about the power kind of that circle where people were sharing. I mean, there were people actually crying, you know, because it was just so powerful for them. And so just, you know, experiencing that and understanding, like, the whole piece about backpack. So people are carrying everything they own on a backpack, and you are trying to give them food, but they have no place to store it. And just how that opened up perspectives for people about, well, gosh, there's this simple solution, and it engaged the people who are part of it in such a meaningful way that they want to help to find solutions. So that is another way of we've talked about the shared leadership, distributed leadership, I think, going through this practice. So I don't know if you guys, because I know that's something that's really important to the both of you in Napa. We've talked about that a lot. Any reflections on that piece at all, just to kind of reiterate?
Sure. I think we understood, as the ones primarily managing the study from within Napa County, that there was a risk that we would be seen as the owners of the problem on the other end. And we realized that was politically untenable, that is financially impossible. And so we were very intentional about the level of partner engagement all the way through, so that when we arrived at the end of the study and are moving into solutions, that everyone was deeply emotionally committed to what we were doing and saw themselves as a part of the entire process, including the solutions.
Yeah, and I would just add that pivot that I described in who was actually conducting the surveys, I think was really critical to that. Because after that happened, I thought we saw a lot more partner investment in the study, and kind of more of a shared ownership of the study. So that helped us along the way.
Nice.
Yeah, I think when you're using Theory U, which we haven't really talked too much about, but maybe in the context, it's really just engaging the head, heart, and the will of the people that you're working with, right? So it's not just an intellectual exercise, but how do you actually get people's hearts behind the work, and their will, their desire to act based on what it is that you're finding. So that is definitely an aspect of Theory U. I know that we're just about at time. There are a few more slides that I'm going to speak through just to complete the webinar. So if you have to drop off, we understand. And I would just want to say to Jennifer Palmer and Jennifer Henn, thank you so very much for sharing this. I think that, this is a way for us to help people understand just a concrete way of applying Theory U and why it's useful. And it has been such a joy for Sue and I to get to work with you on this. And just a very good concrete project that I think will lead to some really impactful solutions in time. So
thank you.
Thank you.
Yeah, it's been great. Yeah.
So just to share, during the phases, we talked about at a higher level, what shared intent was. So bringing the partners together to understand what is the intent for the shared work and how we can best support one another in creating health with and for the communities. This is a time to listen to the community and how they believe health is created, and the barriers the community members are confronting that prevent health. So going out and asking and figuring a lot of that out. And some examples during this phase of what your ACHs could be producing would be a shared vision for the work that you're doing, mission and goals, forming strong core teams, and figuring out how to work well together with a shared purpose. It could be working drafts that you're testing and iterating in time, beginning MOUs, charters, bylaws, and teaming agreements. So during phase one, these are sort of outcomes that you could be producing with your group. And in phase two, when we look at a greater systems perspective, after coming to an understanding of the shared and common intent among the partners, participants scan selected focus areas and the greater system. They speak to the community members and have relevant stakeholders to fast track your understanding of the system. So that's this real deep dive into learning as much as you can about those that are directly impacted. And some examples of outcomes that could be produced during this phase are mapping of the system. So making a physical map and looking at what it looks like, mapping out the different initiatives, figuring out who all of the stakeholders are and interviewing them. It could be community health assessments, reviewing financial data and cost drivers, community engagement practices such as key informant interviews, focus groups, stakeholder interviews, learning conversations through town halls or world cafes. So hosting dialogues to really take, again, a deep dive to understand more and more understanding of the system. And also to note that you can never actually know an entire system, but the more diverse perspectives that you can bring in to actually help you understand the greater system, the more you'll be able to perceive, right? But always knowing that there's going to always be a gap in understanding of the greater system. And then we move into making meaning. So after immersing yourself into fast and deep learning experiences, ACH members gather together to reflect and share what they have learned to make meaning. And some examples of outcomes that could happen is time together reflecting on what is needed now. So sitting in dialogue and being in the conversation with each other. Briefing papers that are sharing what it is that you've learned through this learning experience, a live stories webpage that's showing you what were the outcomes from the system's perspective, analysis of the system, increased collective knowledge of the end user and gaps in services, journey mapping, empathy mapping, graphic recording, and reporting other data documents and PowerPoints that tell the story. And for the fourth phase, you've got the description of after making meaning from the deep immersion, begin co-creating solutions to the pressing challenges that you're working to alleviate. It's a time for experimentations, prototyping of ideas, services, products, and potential actions that will bring us to the desired state. And so examples of outcomes and products that you could produce during this phase would be identifying leverage points, system barriers that can be tested, to impact some changes, tangible and implementable actions and solutions to be tried and tested, and plan to test solutions. And then lastly, for scaling, this is where we've taken the prototypes and we know what it is that's working and what's going to be impactful, and translating it into a detailed implementation plan and rolling it out. And some examples of outcomes at this phase would be several attempts at prototyping and pilot testing have been done, and we refined systems and or process, agreements on a longer test, and looking to spread and scale in other areas of the ACH. And once a prototype or pilot is successful, finding resources to scale it and creating that plan. And again, just thank you everybody who's joined us here today on this call. If you have any questions or want to reflect with Sue and I, or Jennifer Palmer and Jennifer Henn, please reach out and we can continue the conversation. So thank you.
Thank you, Dana, and thank you, Jennifer.
Thank you.
Thank you all.